people whose COVID-related deaths were confirmed today. As we know, this is a brutal and relentless virus. But let us remember every day that behind each of these statistics and these numbers, there was an individual who was loved and valued and who is now dreadfully missed, and we must never lose sight of that. Whilst our cases are lower today than they were 2 weeks ago, the challenge it poses is certainly not easing off, and the threat remains intense. Whilst I hope we have hit the peak in terms of hospital inpatients, the number of patients requiring critical care is still likely to increase further. As I've said throughout this pandemic, that I will not turn down any reasonable offer of support. The military have already provided extensive assistance to Northern Ireland, often low-key but hugely important. They have transported seriously ill patients from Northern Ireland to England, and they've provided invaluable logistical advice and expertise. And I've been clear that if I thought our armed forces could be of any further help, I would not shy away from requesting their support. And we have now reached that stage, so that is why I can confirm that late last week, when it was made known that a number of medical technicians were available, that I formally requested assistance from the Ministry of Defence to help ease the huge strains on our hospitals and on our nursing teams in particular. So following intensive engagement over recent days, earlier this afternoon the Ministry of Defence and the UK Armed Forces Minister confirmed to me that they would be providing us with over 100 medically trained technicians. This is a hugely important resource, and one which is coming at a particularly challenging and critical period for our health service. And I sincerely hope that this will not be viewed as a divisive decision, because I can assure you it's not. Our armed forces have medical expertise, and as I have said, it would have been an abdication of responsibility on my part if we didn't avail of that. But thankfully, the lockdown is working in terms of pushing the infection rate down, and that's due to the determination and sacrifices of people across Northern Ireland, and I pay tribute to you and thank you for that. But we need to force those numbers down further, and we need to get on top of the situation. Tomorrow the Executive will be reviewing the current restrictions, and I will be bringing a paper to that meeting setting out my recommendations. As usual, I will not preempt those discussions, but I can make clear that this is not the time to open any floodgates. This is not the time to take premature decisions that would lead to another spike in cases and yet more crushing pressure on our hospitals. We have to stay the course on this as individuals, as a society, and as an executive. There is hope. There is hope because we have made a really encouraging start to our vaccination programme. Patricia Donnelly, who is with us today, will speak more on that shortly. I can confirm that the total vaccinations administered as of close of play yesterday now stands at 160,396. That includes 1,380,436 first doses and 21,960 second doses. I urge people to be patient. I understand their frustration. However, we can only vaccinate people when we have vaccines available. Supplies will come, but they will not come all at once, and we cannot go faster than those supplies allow. But before I conclude today, I want to send my best wishes to my executive colleague, Minister Edward Poots, and his family following his cancer diagnosis. As we know, he is sadly not the only one anxiously waiting for surgery. It's a matter of great distress, not just for me, but for everyone involved in healthcare, that cancer services have been adversely affected by this pandemic. Whilst we have mechanisms in place on a regional level to fully utilise all remaining hospital capacity to prioritise our most urgent cases, including in the independent sector, it is hugely regrettable that there has been an impact on such key services. We need to do all that we can to put that right. We need to rebuild our health service, and that includes pushing down COVID infection rates to protect non-COVID services. Rebuilding cancer care is not about going back to where we were at the start of 2020. Cancer services were already fragile. Waiting times, as I have said before, were already unacceptable. And when we get through this pandemic, and we will have a monumental task on our hands to reconstruct our health and social care system. COVID will blight lives and services for many years to come, and rebuilding will require significant and long-term investment. This week saw the release of the draft budget for Northern Ireland for 21-22, and I would encourage everyone to take part in that consultation process, the consultation process on this budget. The Finance Minister has rightly described it as difficult and has warned that it will not provide the stimulus needed to kickstart a strong economic recovery. But as Health Minister, I have to similarly warn that it will not provide the basis for a sustainable rebuild of our health service. What we need is a long-term financial settlement for health and social care, a settlement that allows us to transform services and tackle core problems including waiting lists, staffing and staffing supports. It is my opinion that this draft budget falls well short of that. And I say that not to make a party political point or to criticise my executive colleagues. This is a tough budget for all departments, and we certainly hope that Treasury rethinks its approach to public spending. But if it doesn't, difficult decisions will be required at a local level, and I will battle with all my energy and determination to secure more funds for health, because that is my job and that is my responsibility. I owe it to all those on waiting lists and to our staff trying to hold a teetering system together. I'll now hand over to the Chief Executive of the Northern Trust, Jennifer Walsh, who will now provide an update on the current pressures of our health service. Jennifer.
Thank you, Minister. Good afternoon. As you will all be aware, my Chief Executive colleagues and I have recently released two joint statements, a seldom used step, one on the 14th of December and one on the 10th of January 2021. In these statements, we expressed our concern at the level of community transmission of COVID-19 and the pressures that increasing numbers of COVID-positive patients requiring hospital admission would place on our health and social care system. All of the modelling projections available to us were indicating that we would see the peak in this particular surge now, the third week of January. Those modelling projections have been of enormous benefit to all trusts in preparing surge plans, with the emphasis on flexibility and agility to meet the actual circumstances that evolve on the ground. There has been considerable variation across the region, with different postcodes showing different intensity in terms of COVID-19 positive cases. High levels of community transmission always translate into later pressures in emergency departments, medical wards, enhanced respiratory services, and ultimately into intensive care units. Trust services remain under significant pressure this week, with further rises in ICU admissions already experienced this week and more we expect. All trusts are and will continue working together to best manage this surge, but also to ensure that the resources that we have are used to best effect, both within this surge and also as we emerge from the current high-pressured situation. We are confident that we will be able to cope with the expected numbers, but as the Minister has said, that has come at great cost. With very high numbers of people requiring respiratory support and also intensive care, we have been forced to redeploy skilled staff from other areas, particularly theatre staff, to meet the requirements of those very sick patients. That has seriously impacted on our ability to perform our normal elective surgery work, including cancer and other time-critical surgery and diagnostics. And this is not a situation that any of us wish to see. However, the entire health and social care system is working together like never before. Urgent surgery, including cancer, is one area where we have and we will continue to prioritise those who are most in need. And we will allocate the precious surgical slots that do remain as a region. Trusts have also worked together to transfer patients across hospitals to best manage the demand within the regional resource that is available, whether that is staffing or beds or oxygen. All of our health and social care staff have performed incredibly, and society as a whole can be justly proud of them for what they have had to contend with over such a long period. They have gone well beyond what could reasonably have been expected of them. But staffing pressures do remain a significant challenge. Pre-existing staffing pressures have been well rehearsed. When we add in COVID-related absence as well as absence for other reasons, this is far from a comfortable position to be in, particularly given the situation that we face. The impact of the COVID-19 pandemic on the mental health and well-being of the public and of our staff is unfortunately an evolving story. Anything which alters the norm, and we can think about restrictions now to visiting, wakes, funerals, the closure of places where people traditionally interact as human beings, lockdowns, all of this impacts on our health and well-being. And the same is true for our staff, particularly given the constant pressure that they face and the sadness and the despair that they witness firsthand on a daily basis. All of this will inevitably take its toll, and as a society we need to be mindful of that, mindful of the potential effects for years to come, and to provide that support that they're going to need. So in conclusion, while we all welcome the apparent reduction in new positive cases, this is certainly not a time for complacency. It is clear that a return to normal is still some way off. But the hope that is provided from the vaccination programme must go hand in hand with the necessary precautions in terms of public behaviour and compliance with restrictions. None of us like lockdowns, but the reality is that they do work, and for one simple reason: they help to stop people spreading the virus. Everyone knows the rules by now, so my plea is that we keep doing what we are doing so that we may stay on the path to some form of normality as we once knew it. Thank you.
Okay, thank you, Jennifer. I'll now ask Dr. Patricia Donnelly, our Director of Vaccine Programme, to give an update.
Thank you, Minister, and good afternoon. Let me start by personally thanking everyone involved with the COVID-19 vaccination programme across Northern Ireland. It's the biggest vaccination programme any of us have ever seen and ever, hopefully, likely to see. It's a huge logistical exercise, and inevitably it's not without its challenges and its frustrations. But we will get there. We will do so thanks to the commitment, the skill, the enthusiasm of the vaccinators, both in general practice and at trust level, who've been working so very hard. Everyone is equally determined to vaccinate as many people as possible, as quickly as possible. And as the Minister said, we've made a very good start, but we say that in the full knowledge that we've a long way to go. As you've heard, we've had 160,000 doses administered of the vaccine and 138,000 people vaccinated. Just over 80% of our over 80-year-olds have received their first vaccinations through their GP, and that should climb very quickly in the next few days and week. As we announced yesterday, we now have enough supplies to complete all 80-year-olds and over, and to make a start on those who are 75 years and over. And we've now completed care homes, other than a very small number that have been in outbreak. And my message to the public is, please bear with us. We'll move as quickly as supplies permit. We will all have to be patient, so please wait for your GP to contact you. They want to vaccinate you as soon as possible. They're not dragging their feet. Supplies are the limiting factor. As soon as we receive it, we allocate it and they use it. This is certainly not unique to Northern Ireland. Vaccination progress all over the world is also dependent on these supplies, and I'm confident that our progress to date in Northern Ireland stands comparison to other countries. So, as things currently stand, we don't have enough vaccine to complete all over 75-year-olds, but we expect that to change in the very near future, with deliveries expected in the next week. In the meantime, we do what we can and we just get on with it. We continue to communicate with our GPs and to work very closely with them. But it is a long haul. It will require time, and it will require cooperation across the whole system. I can provide a number of updates on other issues, because we are about to complete our first doses for health and social care workers within trusts and that wider health and social care community, and for those who have provided client-based services on the Trust's behalf. And we'll widen the use of the Trust vaccination centres in the coming weeks for other priority groups in the wider community. We're working very actively at that this week, and we'll announce more details of this when we have those plans completed. I can also confirm that vaccinations can now proceed for those aged over 80 years of age who are confined to their homes. We did have to take a little bit of advice about how that could be done safely. That advice is now available. And we're continuing to receive questions about where carers come in the vaccination programme. Well, we get questions from lots of groups, but I fully understand the anxieties of those who are waiting. The Joint Committee for Vaccination and Immunisation have set out the very clear priority for when we call which groups, and they have included carers in its phased prioritisation programme, and they're in the Priority 6 group, and that includes all those aged 16 years to 64 years of age with underlying health conditions which put them at higher risk of serious disease and mortality. So you'll understand we want to get to this group as quickly as possible. And JCVI further advises that vaccines should be provided to those who are in receipt of a carer's allowance, or those who are the main carer of an elderly or disabled person whose welfare may be at risk if the carer falls ill. Under the Northern Ireland vaccination programme, vaccinations of the people in Priority Group 6 will begin in March 2021, but we'll try and do this earlier if we can manage it, subject to the vaccine availability. So again, I want to say to all of those involved in the programme, thank you for your support, thank you for your patience, and for all those waiting to receive the vaccination, we will get to you as quickly as we possibly can, and we're working very hard to do so.
Okay, thank you, Patricia. Marie-Louise?
Yes, I know, I'm just wrestling here with the technology. Minister, confirmation that the military is being brought in to assist medical staff in Northern Ireland. This could be seen as an indication of just how serious things are going to get over the next perhaps week, 2 weeks, even out of control. Do you acknowledge that they could be arriving a little bit too late?
I think what we've done in this military aid to civil authorities request, the MACA request, Marie-Louise, around this specific group, it's a specific group of medical technicians which have become available to all the devolved authorities plus sections and regions and trusts within England as well. So when that resource was made available to us of those specialised medical skilled individuals, we started the conversation and the engagement a couple of weeks ago as to how they could be deployed and utilised here in Northern Ireland. As I say, there's a lot of programming and discussion has been going on in the background as to where we could utilise those, and that agreement that MACA was signed off this afternoon. So it does provide valuable and critical support of a skill set that we currently need and we have seen, and we have acknowledged the pressure that our health service is currently under and the staff that's working in it. So any assistance, any support that they can give is welcome at this time, because we have been clear. You know, we were clear that this would be a challenging winter. We knew when we saw the positive number of cases that this part of January, for the next 7 to 10 days, we'll see the most intense pressure come on our health service. So this assistance is vital and it is welcome.
Second question, Minister, are you satisfied that all is being done to utilise those non-COVID sites across Northern Ireland? I acknowledge that there are very few where surgeons can be placed in order to tackle the most serious red flag cancer cases. And I am aware and I acknowledge that resources are tight and the number of staff available are tight, but it's my understanding that there are some staff, particularly surgeons, available who could be carrying out the most urgent red cancer flag cases. Are you satisfied that there are sites that there's nowhere available in order to carry out these operations?
And thanks, Mary-Louise, for the acknowledge. I'll ask Jennifer to pick up on the detail, but what I will say, we may have theatres, we may have surgeons where we fall down and where our pressure is then is in those theatre nurses and the anaesthetists. That skill set that we have to deploy to support our ICU units. So when we stand up the regional facility in the Nightingale and the Tower, we have to get that skilled resource from somewhere. And unfortunately, that's where that skill set is based. It's within our theatres, it's within our anaesthetists. And that leaves then the surgeons who have a critical part to play, but without their crucial and critical support teams. So we have utilised, and I think you're aware, you and I have had this discussion, we had it on Friday in regards to the regional approach that we're now taking. Now that has seen a challenge to our trusts, working outside their comfort zone as regards to how we support all those patients who need that support. But as Jennifer indicated in her opening comments, that's an approach that we have now seen working collaboratively across all our trusts that will see those most urgent cases brought to the fore. Jennifer, is there anything you wish to?
Yes, thank you, Minister. Yes, that's exactly it. It's a really difficult situation. We have theatres available, we have surgeons available, but unfortunately we have had to redeploy anaesthetists and theatre nurses to be able to work in intensive care as well. There is a very small amount of cancer surgery ongoing, and if I could maybe just explain how that was working within the Northern Trust area, for example. We have not been able to carry out any cancer surgery or indeed anything but emergency surgery in the Antrim Area Hospital site since the beginning of January. We are able to do a small amount at Causeway. So to maintain emergency surgery at Causeway, for example, we need to maintain a certain number of staff there, and they are able to carry out both the emergency surgery and a small amount of cancer surgery at the same time. And there are a small number of sites across Northern Ireland that are able to do that. I do want to talk a little bit about the sites that are green. It is really, really hard now because of the level of community transmission that we have to be able to call any site green. Any site that has an emergency department or a front door could no longer be described as green. You might have areas within that site that are COVID secure, that you can protect, but we are dealing with COVID positive inpatients across all of our hospitals. And I suppose I would want to reiterate that message. It is good news that the overall number of new positive cases is starting to reduce. That is really welcome. We need to continue to drive that down, because that is the only way that we can then redeploy staff back out of intensive care units again to get surgery restarted in the way that we would want to. So the small amount that is going on is being looked at on a regional basis. So what we might do in the Northern Trust may not just be for Northern Trust patients, and I know colleagues in other areas where they are able to do some surgery are doing the same. We are looking at those who are most in need right across Northern Ireland. But these are precious surgery slots. It is not enough. It is vital that we drive this infection down.
Sorry guys, I always keep my finger on the mute button. Minister, can I ask you, are you expecting any resistance within the executive to this move to deploy technicians to hospitals here?
Sharon, I sincerely hope not. I understand the political presentational challenges that it may bring, but what I will say to anybody who see this should only see this as the opportunity to support our health service at a critical time. That's why I made the request that I did, and it's the spirit that the request was made. And it's not to make any political point, it's not about any presentational point either. It's about to provide that critical support to those people working in our health service who are under pressure and who will remain under pressure for the next number of weeks. So it's about critical support rather than anything else.
And on that, obviously, with the military in hospitals, I mean, there are some people here who are dissidents who will use and exploit any opportunity, Minister, as you well know, to try and wreck peace here. I mean, is this not a potential security nightmare as well?
Sharon, there has been a lot of work, as I say. We've been discussing this specific request over the last couple of weeks. That background work has been done. It is ongoing, and for any of those who would seek to make a target out of our health service at this point in time, I would say they'd be better not being about Northern Ireland, and not be better not being here as well. When they see the pressures that are on our communities, that are affecting every home, every community, no matter what race, religion or political persuasion, that if anybody sees this as an opportunity to make a political statement or even target any individual within our health service, I would say we'd be shaming them and shaming anybody that has anything to do with them. Thanks, Sharon. Hi, Rebecca.
Hi, Minister. I just wanted to ask, can you explain a bit about what the military are going to be helping with? You referred to medical technicians, so is that to help relieve the pressure on nursing staff at that level of it? Would they be based in the Nightingale facility? Is it possible to say a bit more about that?
Rebecca, I don't want to get into the specifics of that today. We will make further updates on that, but it is to provide that wider support across the entirety of our health service. And as I said, these are medical technicians, so they come with a skill set that we can utilise within our hospital facilities to support our already overstretched staff.
Thanks, Minister. Just to ask Patricia Donnelly, just in terms of the vaccination programme, there's been references made to people approaching, particularly young women, outside vaccination centres to try and put them off the vaccination by making suggestions about impact on their future fertility. Is it just the one centre where that's happened, or has this been a sort of problem across a few centres? And is there any action being taken to try and protect people coming in for their vaccinations?
You're absolutely right. We do want to protect people coming in to get their vaccinations. I'm only aware of 2 centres where that's occurred, but there may be others. And it's a small number of people. The police are aware of that. There's controls around it about how close they can get to the vaccination centres. And this kind of misinformation is incredibly unhelpful, because anyone who's been called forward for the vaccination needs to have it, both to protect themselves and those vulnerable people that they work with. So this is really unfortunate, and however motivated, it really does not help a difficult situation. So we're keeping an eye on it with the support of the police and others.
Rebecca, we're also aware of a door-to-door leafleting campaign going on in regards to the same groups in very, very small, sporadic geographical settings, which would be in complete breach of COVID regulations as well. So not only are these people putting people off receiving the vaccinations, they're also putting themselves and others in danger. So it's about, I have no problem with free speech in opposition to many things that I do or I say, but the fact that some of the leaflets that they are distributing are completely inaccurate, if not false. So again, it's not helpful to our overall medical approach to this or to the supporting of our medical staff. Hi, Tara.
Yes, good afternoon, everyone. First question for the Health Minister. I mean, it's my understanding, Mr. Swann, that this is presumably going to be Army medics helping out on wards, but first of all, is 100 enough? And secondly, is there any way that they could help out with the vaccination programme as well, like they are doing in England?
Thanks, Tara. As I've said, this is a specialised skill set that we've been made aware that is available, so we have approached it. We have no need for them in our vaccination programme at this minute in time. As Patricia has made clear, our limiting factor within that is actually the supply vaccines. So between our trust facilities, our regional facilities and our GPs, we are well covered and well supported for that programme. In regards to, and I know a number of 100 has been floated, what I will say is in regards to this, when we look at the number of ICU beds, to increase our ICU bed capacity by 15, we need 100 nurses to do that. So that is where this skill set becomes, and this additional deployment becomes critical, because it allows us to backfill those slots that we have needed and we will need over the past week and the future couple of weeks, and making sure that we have enough intensive care beds available for the people who need it.
Thank you, Minister. And just a follow-up then for Jennifer. We had heard the figure this week that almost half of patients in Antrim Area Hospital had COVID. Is there an update on that at the moment, or what are your thoughts on that?
Yes, thank you, Tara. So the situation has changed very marginally in Antrim. So we're now sitting with about 46% of all of the patients within Antrim who are COVID positive. The highest number was actually last Thursday, a week ago, at 166 patients, and that has dropped now to 140. That's still obviously a very, very high number at 46%. And the site is still under significant pressure. The situation is also changing at Causeway Hospital within the Northern Trust area. So last Thursday, when Antrim was at its highest, Causeway had 35 COVID positive inpatients. Today that is sitting at 49, 47 of them already admitted and in a bed, and 2 in our emergency department. And the levels of COVID occupancy then in Causeway has now crept over 30%. And whenever I look at the postcode analysis as well, I think that is likely to continue over the next number of days, and we will be watching that very carefully.
Thanks, Tara.
Minister, question for you. On the basis of the draft budget, which was published this week, what is the situation in relation to tackling waiting lists and increasing staff numbers in the Health and Social Care Service?
Thanks, Lisa. And I suppose I do want to make clear that my comments weren't political, but we are entering a consultation period in regards to the budget and the budget that has been produced. It would be remiss of me if I didn't make a greater push for the support that we need across health. The indications that we have in the draft budget is an increase of 5.9% on last year. We know we need 6%, our health needs 6% year on year, specifically to stand still. So that allows us to basically do nothing in regards to further transformation or further staff increases as well. It allows us a bit of leeway in regards to staff salaries and recognition as well. So when it comes to that further strategic piece of tackling waiting lists, we need not just the commitment that comes in this year's draft budget, but we also need we need a recurrent commitment to supporting health. It's not a fault of our finance minister or our executive that we are working on a single year budget, but we need in health, we need that recurrent confirmation of support financially, so that we can really put in a long-term programme in regards to how we tackle our waiting list, but also enhance our staff needs and our staff skill set, because there's many of those staff who are working on transformation projects that are going year from year on a temporary posting, that we can't make that transformational changes and actually embed it into our health service, changes that we know we need to make, changes that we want to make, and changes that would actually acknowledge what Bungoa told us we needed to do a number of years ago.
And secondly, on the issue of waiting lists, how much longer will cancer patients who have had their operations cancelled have to wait for their surgeries to be rescheduled? You told me last week you were hopeful that it would be weeks, but having spoken to some patients in the last few days, it seems it could drag on into March, possibly later.
Well, Lisa, and again, it goes back to the opening comments that I made. The more COVID patients that we have to support, the longer it takes us to get back to doing those critical surgeries. And again, in answer to an earlier questions, it's not about the availability or just about the availability of theatres or surgeons, but also those critical care nurses, those ICU nurses, the anaesthetists, that are all needed to provide that overall holistic package that we need to provide cancer surgery. But one thing I will say, and Jennifer's mentioned it, is about the regional approach that we are taking, so that any surgical slots that are available anywhere across Northern Ireland will be made available to those who are most critically in need, assessed on clinical need, not by postcode or not by, I suppose, not by clerical staff, but also by the medical needs and the clinical assessment that is made. Jennifer, do you want to maybe just finish on that?
Yeah, it's exactly as the Minister has said. I think it's very difficult to put a precise timescale on this at the moment. It is hugely important that we continue to drive the COVID positive numbers down. The surgery that we're able to provide at the moment is just simply not enough. And while we are prioritising people, that is a huge challenge for the clinicians who are involved in doing that prioritisation, because they all know, we know, that people are waiting longer than we would like them to wait. So it is crucial that we continue to do what we can around driving down that infection to get our staff back to where they need to be and doing the operations and the other procedures that they need to be doing.
Thanks, Jennifer. Thanks, Lisa. Okay, folks, that's